everyone, good morning. This is Theresa Alota from Bachelor of Science in Nursing Section 1A6, and today I will be conducting HINT assessment or head, eyes, ears, nose, and throat assessment. Prior to the conduct of the assessment, first we must prepare the needed materials for this procedure to conserve time and energy. Right after preparing the necessary materials, we can now proceed to identifying our patient, explaining the procedure to them, and observe proper hand hygiene. Hello, good morning, ma'am. I am Theresa Alota, your student nurse for today, and I am from Southwestern University, FENMA. May I have your wristband, ma'am? Kindly state your name.
Angel Faith Alota.
Okay, how about your birthday?
November 20, 2009.
Okay. So, explain the procedure to the patient so that the patient can know what procedure you will be doing to her. So, ma'am, the procedure that I will be doing today is the HINT assessment, in which I'm going to assess your head, your eyes, your ears, nose, and throat for any abnormalities present. And you don't have to worry, since all the information that I will be getting today will be kept confidential and will be handed safely to your physician. And if you feel uncomfortable, feel free to raise your concern right away. So do you want me to repeat it again?
No.
Also, do you have any question before we proceed?
No.
After explaining the procedure to the patient, we need to observe proper hand hygiene and observe privacy to the patient. And we can now start the physical examination. The very first thing that we need to do is to inspect the head of the patient. So inspect for any discoloration like cyanosis, jaundice, or pallor, and also inspect for lesions and facial hair distribution, as well as inspect the size and the head of the patient if it is symmetrical. So okay, right now, ma'am, I'm going to inspect your head. So inspect for skin color. So far my patient has a pinkish color, which is fine. Then inspect also for lesions. So if lesion is present, make sure to have the centimeter ruler with you so that you can note the size and the shape of your of the lesion. And next, inspect for the size of the head. Make sure that the size is appropriate to the body size of the patient. Also check if the face of the patient is symmetrical. So observe for any drooping of the face on the one side. So I don't see any of that. Next, assess the facial expression of the patient to check her facial nerve. Okay, Ma'am Angel, can you please close your eyes tightly and open them up afterward? Okay. And then can you please smile for me? Can you please make a frown face? And then can you please puff out your cheeks? Like that. Okay. So the patient demonstrate the facial expression at ease. So her facial nerve is intact. Next, we need to palpate the skull of the patient. So in doing that, we need to don our gloves to protect ourselves as well as the patient from any cross-contamination of infection. In palpating the skull, make sure to observe the mass indentions as well as if the patient has alopecia or insect infestation or lice infestation. So let's start with the inspecting the mass indentions. And also check for the skin breakdown. And then check for alopecia or any baldness on the head. And then lice infestation. Okay, so far the patient has no lice as well as she has no alopecia. After palpating the skull, we also need to palpate the temporal artery as well as the temporomandibular. Okay, observe for any tenderness and swelling on the area. And in palpating the temporomandibular, instruct the patient to open her mouth. Ma'am, can you please open your mouth? Close. Open again. Close. So far, the temporomandibular of the patient has no swelling or tenderness, which it is a sign for normal findings. After palpating the temporomandibular, we need to remove our gloves so that we can proceed to the next procedure. Next, we need to inspect the external eyes of the patient. We need to inspect the eyelids, the eyebrows, the eyelashes, the sclera or the white portion of the eyes, and then the conjunctiva of the patient's eyes. Also check for any discoloration of the eyes, such as jaundice or yellowish color of the eyes. So inspect the conjunctiva of the patient by pulling down the conjunctiva and have the patient look up. So right now, ma'am, I'm going to check your conjunctiva. So can you please look up? Make sure that you only see pinkish on the conjunctiva. So if you see any red or drainage on the conjunctiva, it signifies that the patient has any abnormalities on her eyes. Also inspect the cornea, the iris, the pupil of the patient's eyes. Then note for any swelling of the eyes and abnormalities such as strabismus or the misalignment of the eye. Make sure that the eye is symmetrical and aligned. And also note for any abnormal conditions such as drooping of the eyelids, and if the pupil is larger than the other one. So make sure that the pupil is 2 to 3 centimeter wide. So far my patient has a 3 centimeter pupil in both eyes. Right at this moment, I'm going to check the pupillary accommodation and convergence of the patient's eyes. And by doing this, have the patient stare at the distant object, and that helps to dilate her pupil. So right after that, move the object slowly inward. And if the pupil of the patient constrict, that's a sign for a normal pupil. So right now, ma'am, I'm going to check your accommodation and or pupillary accommodation and convergence. So can you please stare at this object, and then do not move your head as I move slowly the object, okay? Okay, ready? So far, the pupil of the patient constricts, so it is a sign for a normal pupil. And then right after checking the accommodation and the convergence of the pupillary, we need to use or utilize the ophthalmoscope for the red reflex of the eyes. Next, we need to check the visual acuity of the patient's eyes. And by doing this, we need to utilize a Snellen chart that is placed 2 feet apart from the patient, and have the patient read the Snellen chart. First, using both 2 eyes, and the second is to only read it with the right eyes or the left eye. So right now, ma'am, I'm going to test your visual acuity. So can you please read the letters that is above the green line?
E, D, E, C, Z, P.
Okay, so right now I'm going to cover your left eye. So you need to read it with your right eye, okay? Go.
E, D, F, C, Z, P.
Okay, so right now I'm going to cover your right eye. So you need to read the letters with your left eye.
E, D, F, C, Z, P.
Right now, read those letters that is above the red line using both of your eyes. Go.
D-E-F-P-O-T-E-O.
Okay, now I'm going to cover your left eye, so you need to read it with your right eye.
D-E-F-P-O-T-E-O.
Okay, so right now I'm going to cover your right eye, so you need to read it with your left eye.
D-E-P-F-O-T-E-O.
Okay, so the visual acuity of my patient is 20/25. To inspect the involuntary shaking of the eyes, have the patient stare at the distant object for about 12 inches and perform the 6 cardinal position of gaze. Okay, ma'am, can you please stare at this object? And as I move the object, I'll move your eyes with the object, okay? Okay, don't move your head. Is that clear? So, go. So far, I don't see any involuntary shaking of the eyes. So, my patient's eyes is normal. Right after inspecting the eyes, make sure to document all the findings that you have gathered. So right after that, we can now proceed to inspecting the ears of the patient. Right at this moment, I'm going to inspect the external ear bilaterally. So inspect for any abnormalities, swelling, and also if there are any drainage. Okay, Ma'am Angel, so do you feel any pain on your ear recently?
No.
Okay, that's good. So right after inspecting the external ear, we need to palpate the ear and the mastoid process that is located at the back of the ear. Okay, so do you feel any pain? So check for any tenderness and sensation on the area. Also observe for swelling. Okay, here, do you feel any pain?
No.
Okay, the other one. Do you feel any pain? Okay, here.
No.
So far, the mastoid process of the patient has no tenderness present, as well as her ear. So now we proceed to inspecting the tympanic membrane by the otoscope. So in utilizing the otoscope, if you're assessing a patient, an adult patient to be exact, make sure to pull the auricle up and back. And if you're assessing a child, make sure to pull the auricle down and back. So note for cerumen, swelling of the ear or the tympanic membrane, drainage of foreign bodies, and the condition of the tympanic membrane. And right after that, check the cranial nerve 8 of the patient. So have the patient cover his or her ear while you whisper 2 feet away from the patient. So check both of the ears. So what you're going to do right now, as I whispered some words, you need to cover the ear that is being tested, okay? So can you please cover your left ear? And then when I asked the word that I whispered a while ago, you said those words, okay? Okay, so cover your ears. I am pretty. So what did the words I said?
I am pretty.
Okay. Okay, so right now, ma'am, I'm going to test your right ear. So can you please cover your right ear? Okay, so maybe. So what is the word I said?
Maybe.
Maybe. Okay. So the cranial nerve 8 of the patient is intact. If the patient reports diminished hearing in either ear, you need to use tuning fork to test the hearing of the patient. After inspecting the ear of the patient, make sure to document all the findings. And now we can proceed to inspecting the nose of the patient. So the very first thing that we should do is to inspect the external nose. Okay, ma'am, right now I'm going to inspect your nose. So inspect for any lesions, swelling, and also the color of the nose. Ask the patient if she has a problem with her nose recently. Okay, Ma'am Angel, do you have any problem with your nose recently?
No.
How about drainage in your nose? Okay. And right after inspecting, palpate the external nose. So right now I'm going to palpate your nose. Is it okay?
Yes.
Okay. So palpate for any tenderness. Do you feel any pain here at this area?
No.
How about here?
No.
Okay. So, right after palpating, percuss slightly the maxillary and the frontal stenosis. So right now, Angel, I'm going to percuss your maxillary stenosis and your frontal stenosis. Is that okay?
Yes.
Okay. So far, it is normal. And right after percussing the maxillary and the frontal, we need to check the patency of the nose of the patient by occluding the external nostrils of using the finger, and then breathe on the other side. So right now, I'm going to check your patency of your nose. So I want you to occlude your nostrils, external nostrils with your hands or your fingers, so like that. And then breathe on the other side of your nostrils, okay? Do you understand?
Yes.
Okay, so can you please occlude your right nostrils? And then breathe. Okay, so the other one. And then breathe. Okay, thank you. So far, the patency of her nose is normal. And so in checking the internal nostrils, you need to use otoscope with the nasal speculum attachment. So check for any abnormalities, any drainage on the nose or the external nostrils. Right after that, document all the findings that you have gathered on the nose of the patient. Right at this moment, I'm going to assess the mouth of the patient. So first, we must palpate for the temporomandibular joint that is located near or behind the ear of the patient. Okay, so right now, ma'am, I'm going to assess or palpate your temporomandibular. Okay, can you please open your mouth? Close. Open it again. Close. Okay, thank you. So, we need to check if there are any tenderness or swelling or pain on the temporomandibular joint of the patient. So far, there's no tenderness present on that area. So, let's proceed to inspecting the mouth of the patient. But before we proceed to inspecting the mouth of the patient, make sure that you perform proper hand hygiene and don your gloves. So here, I already done my gloves, so I can now proceed to inspecting the mouth of my patient. So since I don't have any tongue depressor, I have a spoon as an improvised object. Okay, so right now, ma'am, I'm going to inspect your mouth. Okay, so let's start with your lips. So the lips of my patient appears pinkish. It's normal. So her lips is not dry also. And then can you please open your mouth widely? Okay, and then inspect for her tongue, the soft and the hard palate, and also the salivary gland opening. Also check for her gums and the gingival teeth. And also her tongue. So far, I don't see any problems with her mouth and any other parts of her mouth. Hey, ma'am, can you please stick out your tongue? And then move it to your right. Okay, to the left. And also, can you please say ah? So I'm going to check your vulva if it's not swelling. Okay. So, I'm also going to palpate your tongue. Okay? So, can you please say ah? And then stick out your tongue. So, palpate for any tenderness or swelling of the tongue muscle. So far, I don't feel any tenderness on her tongue. So, her tongue is fine and good. So, now I'm done assessing the tongue of the patient. I'm now going to remove my gloves. So right after removing the gloves, you need to document all the findings that you have gathered from the mouth. And now we can proceed to assessing the posterior neck. First, we need to palpate the forehead down to the triangle, posterior triangle of the patient using our finger pads and in a circular motion. Okay. So check for any tenderness or any sensation or pain. So do you feel any pain here, Ma'am Angel?
No.
Okay. So check also for posterior cervical lymph nodes. And then palpate the front of the ear and the back of the ear. So do you feel any pain here, ma'am?
No.
Okay, that's good. So far I don't feel any tenderness nor swelling. How about here?
No.
Okay, so down to the chin of the patient. Okay, no tenderness present. And next, we need to palpate and inspect the left and right carotid arteries. So take note that only palpate one carotid artery at a time. So don't palpate them bilaterally, okay? So, and then auscultate the carotid artery using the bell of the stethoscope. Okay, so right now, ma'am, I'm going to auscultate your carotid artery. So I'm starting from your right. Okay, so far, her carotid artery is pulsating normal. Then we can now proceed to the anterior and assessing the anterior neck. So first, inspect and palpate the trachea of the patient. Then palpate it slowly. So note for any tenderness that felt. So next, inspect the thyroid, Next, inspect the thyroid gland of the patient. So observe if the patient has a goiter or the enlargement of the thyroid gland. So far, the patient has no goiter. And then, palpate for the thyroid gland. Note if there are any tenderness felt. And next, inspect and palpate the supraclavicular area of the patient. Also note for any sensation or tenderness felt. Do you feel any pain here, ma'am? Okay, so the patient has no tenderness present on her supraclavicular. Next, I'm going to assess the ability of the patient to move his neck. Okay, ma'am, can you please move your chin on your chest? Can you touch it? Yes. Okay, can you please move your chin on your shoulder, left shoulder? Do you touch it? Yes. To the right. Okay, can you please move your head on this side, on the right side? Like that. And then the other one. Okay, can you please chin up as far as you can? As far as you can. Okay, that's it. Can you please go back to your normal position? Thank you. So far, the patient can move her neck without any pain or any difficulty. So, her neck is okay. 4, 3 to start. Okay, we're now done assessing the anterior neck of the patient. So take note all the findings, document all the findings that you have gathered, all the information. And right after that, you need to thank the patient and then bid goodbye to your patient. Okay, so right now, mom, we are done assessing your head, your eyes, your ears, nose, mouth, and throat. So thank you for your time and for your effort. Thank you. Okay, so we are now done with the assessment. So if you have any concerns, don't press 4, 3 to 7. So if you have any concerns, don't hesitate to press that call button so that your concern will be raised right away. Okay? Okay. So right after that, you need to document all the findings and then perform proper hand hygiene to prevent yourselves as well as to prevent your patient from cross-contamination of infection.